Hi all, my name is Dr. Benyam Worku. I'm a psychiatrist and associate professor of psychiatry at Department of Psychiatry, College of Health Science at Addis Ababa University. Today my presentation is going to focus on managing stress and burnout in conflict situations. So this is my outline. So for my presentation today, from time to time, I'm going to come back to this equation, which is called the mind-body medicine equation, which states that stress over resiliency equals to allostatic load equals to vulnerability. This is simply saying that when stress increases and when resiliency goes down, the allostatic load actually increases and makes the individual vulnerable to different problems. So these problems can be mental health problems, they can be physical or medical issues, or they can be burnout and compassion fatigue and so on. So let's start by defining the different variables that are included in the above equation. So stress here is defined as the individual state of uncertainty about what needs to be done to safeguard physical, mental, and social well-being. We are surprised by our sensory appraisals and uncertain about what to do next to maintain our attachments. So stress is what the brain does to itself and other parts of the body when a stressor is perceived as a separation threat. So I think the most important point in this slide is uncertainty. So I think that's very important, and focusing on uncertainty about what needs to be done to safeguard physical, mental, and social well-being is very important, especially in emergency situations and in conflict situations where safeguarding physical, mental, and social well-being actually is very difficult, if not impossible. Resilience, on the other hand, traditionally it was defined or conceptualized as a static personality trait or cluster of traits. Nowadays, the definition has shifted a bit, and it's not anymore conceptualized as something that is very static, but it can be a personality trait or cluster of traits, but at the same time it's modifiable. It's a fluid kind of concept. Maintaining a stable trajectory of healthy psychosocial and physical functioning in face of stress and uncertainty is the essence of resilience. The other interesting concept associated with resilience is something called stealing effect, or what some people would call the anti-fragile effect, which is the fact that previous exposure to moderate amounts of stress or adversity may actually strengthen an individual and lead to resilience with resistance to further stressors. Related with this, the concept of being anti-fragile is it actually goes beyond resilience and robustness. It actually suggests that some people or some systems might actually get better over time, not despite stress, but because of the stress, because of the negative things that are happening in the environment. Allostatic load is about repeated sustained cycles of the stress response, fight or flight, which leads to chronic stress. When we are chronically stressed, our bodies work overtime and overactivate the stress response. Here you can see the allostatic load and the stress response. Moving to burnout in conflict situation, and specifically focusing on healthcare professionals in conflict areas. Healthcare professionals, they have been stressed or distressed by the conflict as members of the society. So it's kind of like some kind of double burden. They're being distressed, and they're undergoing a lot of stress as part of the society, as members of the society, and at the same time, they are also expected to deal with the traumatized members of their society. So it's kind of like a double burden. In addition to this, these healthcare professionals are actually exposed to other exacerbating factors that include witnessing and directly experiencing traumatic events, feeling responsible for people's safety and care, which is important because like in conflict areas, people don't stop getting sick or seeking care. So feeling responsible for people's safety and care is an integral part of practicing medicine in conflict areas. Another factor is disrupted communication or health service management. Working in areas which are not physically safe. Moral distress, which is being unable to provide the service to the extent that you know that you can provide because of limitations in the environment that can include instability and conflict. Insufficient personal time or energy to implement basic self-care. Routine disruptions because of ongoing fighting or other problems. Ongoing and old pressures also continue to play a role in increasing the stress and the distress that healthcare professionals in conflict areas endure. Other factors include uncertainty, financial difficulties, and unmet basic needs. When we look at the long-term outcome of humanitarian crisis, this is for everyone. This is not only for healthcare professionals, but for everyone. There is distress reactions. So change in sleep, irritability, distraction, isolation, avoidance, decreased sense of safety. These are actually very, very common. Other long-term outcomes of humanitarian crisis also include psychiatric disorders, such as depression, PTSD, anxiety, and complex grief. And what we have seen in many humanitarian situations, and also the current conflict, when you visit the places that were affected by the conflict, you will see that there is increased health risk behavior such as alcohol use and separation anxiety. But at the same time, smoking, over-dedication, changing travel, this kind of things can also be outcomes of humanitarian crisis. Burnout is defined as a syndrome that consists of three central constructs. The first one is emotional exhaustion, the second one is depersonalization, and the third one is reduced personal accomplishment. So this is the definition according to Maslach and Jackson. It's also associated with poor quality of care. So this is in the medical setting. It's associated with poor quality of care, it's associated with higher health care costs and threat to patient safety. So there are many factors affecting clinical well-being and resilience related with burnout. In this presentation, we're not going to focus on external factors, although they are very important, especially organizational factors. but more our focus is going to be more on individual factors and what we as health professionals and as individuals can do to help ourselves and also to help our colleagues and our patients deal with stress and burnout. So enhancing resilience is very important in the management of burnout and stress, and it has got three components. The first component is eliciting the relaxation response. The second component is increasing stress awareness and decreasing reactivity. And the third component is cultivating adaptive strategies to respond to potentially stressful situations. Eliciting the relaxation response. So the relaxation response is a physiological state brought about by repeating a word. It can be a word, it can be by focusing on an image, it can be by using sound, it might be through prayer or using of a certain phrase. And attitude of open receptive awareness achieved by gentle disregard to thoughts. So it's about moving away from thoughts and focusing on a certain word, a certain image, sound, prayer, or phrase. So research has consistently shown that 8 weeks of daily relaxation response alters brain structures, including the hippocampus, amygdala, prefrontal cortex, which are critical to modulation of stress and the stress response. So the elicitation goals, the RR elicitation goals include achieving an ongoing RR practice. So if practicing breathing or practicing meditation or yoga or any other RR practice is not going to be effective unless we do it on a very consistent basis. So consistency is key. And it's also the other goal is identifying which RR elicitation strategy is best for you. So one person might benefit from prayer, another person might see benefits from meditation or yoga or breathing exercise or other methods. So it's important for the individual to identify their own strategy which works best for them. And it's also important to practice it if possible on a daily basis so that we can feel more skillful at eliciting RR. So here I have a couple of examples. One relaxation response example is mindful eating. So for example, with mindful eating, the instruction would be to use all of your senses to notice what eating is like. So imagine you are describing the food to someone who has never seen, smelled, or touched it or tasted it. So it's about experiencing the eating experience as if it was for the first time. So it's very important to slow down. It's important to pause between bites, and it's important to take time to savor the taste. And it's important to notice how eating this way is different from how you normally eat. So, for example, if we incorporate mindful eating in our RR elicitation, it might be very helpful because eating is something we do like several times a day. So if we incorporate mindful eating, that can be one way of eliciting RR. So these things might appear trivial, but when you engage in such activities and when you do them consistently, the results are usually very, very impressive. Another RR elicitation that we recommend to people is insight imagery. So for this exercise, what you need to do is you need to adjust your body in any way that feels comfortable, whether it's sitting or lying down. And then you can imagine your favorite season during your favorite time of the day, or you can imagine of a time in the past that you felt very comfortable, very relaxed, or you can even imagine something that never took place in real life. For example, you can imagine, even if you have never been to the ocean, you can always imagine being by the ocean. And you can use, when you do this guided imagery or insight imagery, it's very important to practice using all of your senses. So it's not only about visualization, it's also about smell, it's also about touch, it's also about sound. So we have to incorporate all these modalities when we do insight imagery. And it's also very important to make this imagery your own. You have to bring into this environment anything that pleases you. So you can incorporate anything that makes you feel relaxed and comfortable and free of stress. And at the very end, what you can do is you can take a mental snapshot, a mental photograph, or a mental 3D visualization of this imagery and keep it with you, and you can use this imagery again and again in order to bring calmness and relaxation in stressful or difficult situations. The other component is stress awareness and increasing stress awareness and decreasing reactivity. This is important because stress impacts our thoughts, it impacts our emotions, our physical sensations, behaviors, and relationships. In order to decrease stress reactivity, it's important to, in order to decrease stress reactivity, it's important to learn how to identify your stress warning signs. So it's always a good idea to go back in time and look around and see what specific things in your environment, what specific activities in your environment are causing your stress. And it's also important to go back and examine your physical reactions and see what were the warning signs that you are enduring stress or distress. It's also important to build your stress coping resources. It's also important to proactively develop your positive cognition, pleasant emotions, and health promoting behaviors. Adaptive strategies to respond to potentially stressful situations include reappraisal and coping. It's something we borrowed from cognitive behavioral therapy. Another point would be positive perspective taking, which is finding positive meaning in difficult situations and viewing stressors from an adaptive perspective. Social connectedness is a vital strategy, especially in our community. Stress contributes to social isolation and or disconnectedness. So in order to roll back the effect of stress and counteract the effect of stress, it might be important to engage in cultivating social support, empathy for ourselves and others, and also helping others. Problem solving and acceptance is also an important strategy. Healthy lifestyle behaviors include nutrition, exercise, and recuperative sleep. So these are the three components that are very helpful in terms of enhancing resilience. But before I conclude today's presentation, I'm going to focus on some specific self-care techniques that you can implement and that you can use all the time. One, connecting with others is very important. Like I mentioned, it's actually it's a very vital part of the Ethiopian way of life. Helping and supporting others is also important because it's not only about helping and supporting others. Helping and supporting others also makes us feel good about ourselves, and it can be very helpful in managing stress and surviving distressful situations. Saying something good to our colleagues, to our family members can be helpful. Eating well is obviously very important, since whether you are hungry or not, it affects your mood, and that might affect your day-to-day experiences. So these things, they might appear very trivial, but these are important things in my opinion. Self-compassion is important. Getting only relevant information, going on the internet and reading lots of things that has got nothing to do with your practice, and getting so many negative information. Like these days, all of us are very much glued to our cell phones and to the internet. So getting only relevant information might be one self-care technique. Physical exercise is important. Looking after your sleep is important. Looking after your physical well-being and avoiding alcohol and other substances are also important self-care techniques. As I've mentioned before, most people, when they are undergoing stressful situations, when they are very distressed, they might tend towards using alcohol or other substances. But usually what would happen is these substances might actually exacerbate the stress. For people who are religious, prayers can be very, very helpful. Spending time in nature, if possible, is something that's also recommended. Listening to music can be a good relaxation technique, and it can also help distract ourselves from our day-to-day worries. Taking regular short breaks can be very helpful. So it's not about taking a very long break. It's not only taking about sabbaticals or things like that. It's also about taking regular, very short breaks, 5 minutes, 10 minutes, 15 minutes, and using these breaks. For example, we can do breathing exercises, we can do imagery, or we can do any of the RR exercises that we mentioned before. So before I conclude my presentation, I'm going to give you a few helpful tips. So our recommendation is for you to do daily mini self-check-ins. So reflect just before you go to bed. Reflect on what you did well and appreciate your efforts and contributions. Reflect on what you think you didn't do well. Remember the Messiah syndrome and accept your limitations. Even if we are physicians and we are in the business of healing people, we can't cure everything. We can't heal everyone. So it's very important to accept our limitations. It's very important to accept the limitations of our profession. Reflect on how well you are practicing self-care. Reflect on how you're feeling. Just labeling can reduce the intensity of the emotion. I really like this point because it's not something that we usually do. Usually we don't reflect back and try to find out how we are feeling or what emotion we are experiencing. But just looking at our body and looking at our emotions and our thoughts and identifying what the exact emotion is that we are experiencing at the moment and labeling it can be very, very helpful. And the last point is seek help when in doubt or when you need to. So seek help from your colleagues, seek help when in doubt or when you need to. If you are feeling stressed, if you are feeling very stressed or unhappy or under a lot of distress, it's always important to seek help. So seek help from your colleagues, seek help from your friends, seek help from elders in your community, seek help from religious leaders. Wherever you can get help, seek help, and also provide help. So get in touch with your colleagues, ask them how they are doing. If possible, whether it is, if you are working in a hospital, for example, you can have groups where you can have discussions about what has been happening throughout the week. You can have discussions about your experience during the conflict. So sharing, asking for help, as well as giving help are very, very important. So that's all I have for today. So thank you and stay well.